It's really an honor to stand with all of you today. As I mentioned to you yesterday, this is the first anime conference that I have attended, and I'm so excited to be here. I'm also in particular proud to be with an organization that has its roots really in civil rights advocacy, providing really for the least among us, and an organization that has vocally supported some of the most important social and health policies for our country over the last century. I'm also proud to be in the room with some of our nation's most proud and greatest health professionals. As an organization and as individuals, many of you have worked for over a century, driven by a commitment to improving our nation's health, and I thank you for the invaluable contributions that you've made. Now, President Sanders invited me here today to talk about the issue of minority health and health disparities, and I will do that. But I feel that I can't begin without addressing the issue of racial injustice. Whether it's at the traffic stop of Sandra Bland in Texas, the shooting of Samuel Dubose in Cincinnati, or the killing of an unarmed group of worshipers in Charleston, the injustices suffered by African Americans have been on full display for the world to see these past many months. And while these incidents are not unique to 2015, the frequency and the violent nature of these acts have amplified the voices of those who say never again. They have galvanized those who know words are not enough. And they have opened the eyes of many who thought that racial injustice was a thing of the past. It is absolutely clear, crystal clear, that as Americans, we have a lot of work to do. Now, some critics tell me that as Surgeon General, it isn't my place to talk about racial injustice. And to them, I say that until it is a thing of the past, it is every American's place to speak out against racial injustice. And it is also every American's place, including the Surgeon General's, to reaffirm now and again that Black lives matter. Today in America, as so many of us sadly know, who you are, where you come from, and whom you love plays too big a role in determining your health. Being poor, which affects 1 in 5 children, is too great a factor in determining who is healthy and who is not. In a nation as great as ours, a nation that my parents crossed oceans and borders to reach, that is simply unacceptable. These realities, they hurt all of us. They threaten our economy, our educational system, the productivity of our workers, and even our national security. They bend the arc of the moral universe away from justice. You may have heard me say this, but in case you didn't, let me say it again, that health equity is a civil rights issue. The principle of equity is at the heart of our values of a nation, even if it hasn't always been fully reflected in our practice. But it's also a value that I hold dear because of my own story and the journey that my family has taken. My father and mother grew up in a time and in a place where for many people in their native land, the respect that you received was dependent on the caste into which you were born. The inherent immorality in that idea that your birth determined your value struck them often and stung them in their daily experiences. They came to America hoping that they and their children, my sister and I, would not be judged by who they were born to or how they looked, but rather by what they could contribute to society, and as Dr. King would say, by the content of their character. And as much opportunity as we were afforded over the years, as we were blessed to have been brought up in this great nation, my parents could still not shield me from the subtle and overt racism that I experienced as one of the only Indian kids in our public schools. Those experiences left deep marks in me. They impacted how I saw myself and how I saw others in ways that were often draining and difficult. But they also sensitized me to the inequities that exist in our society, and they emboldened me to speak up against them as I grew up. Now, none of us can completely understand the life experiences of another individual or group. All of our experiences are unique in their own ways. But inequities harm all of us. They rob us of our dignity. They stand in contradiction to our values as a people. And they make us weaker as a community and as a country. All of us know that inequities exist in health. That's part of the reason that we have gathered here today. And this is true whether you look at rates of illness, at outcomes, or at access to care. We have heard, and we will hear more this weekend, about the severity and the extent of these inequities. But as I have traveled to communities big and small all across America as Surgeon General, I have found many reasons to be hopeful that we can overcome and address these inequities. First, I have met people who have struggled for years without health insurance and who have now been able to afford coverage thanks to the Affordable Care Act. I remember a particular woman in Virginia who struggled for years caring for 2 family members who were in nursing homes and for her child who had autism. And all the while, she couldn't afford insurance herself. The day I visited her community, she showed me the receipt that she had, showing that she had been able to enroll in coverage through the AC exchanges for less than $4 a month. And I will never forget the look of relief and happiness in her face. Expanding coverage to the uninsured has been a powerful weapon for reducing inequities. Among African Americans, the uninsured rate has declined by 9.2 percentage points, resulting in 2.3 million adults gaining coverage. All of you here in this room, and those of you who have been leaders and members of NMA who are not here today, all of you deserve a large measure of thanks for this because of the support that you have provided to securing this coverage expansion, and also because of the work that you have done to enroll people in life-saving coverage. So I want to thank you for the great work you've done to expand coverage in the United States. But the second reason I feel hopeful is because of the explosion of tools that are available to now help us understand and target health disparities, particularly in the realm of data and technology. The availability of population-level data and our growing ability to analyze and access this information is increasingly allowing us to identify where disparities exist and target our greatest efforts here. A new generation of technology is also making it easier to communicate and to bring services to previously hard-to-reach populations, as telepsychiatry, for example, is doing to connect growing numbers of people in underserved areas with care that has otherwise been hard for them to reach. And finally, and perhaps most importantly, I feel hopeful because of the people that I meet all across America. People who face long odds, but who find the courage and the creativity to design solutions for some of our greatest healthcare challenges. People like the men and women that I met in Birmingham, Alabama, who decided to run, walk, and swim together out in the open in their communities to set an example of healthy living for their neighbors. The same people who went door to door, knocking to recruit others to walk, run, and swim as well. But perhaps my most memorable encounter was on a plane that I took from Washington, D.C. to Birmingham, Alabama. And as I got off that plane, I realized that Miss Amelia Boynton had been sitting just a few rows in front of me. She was the brains, as many of you know, behind the 1965 March for Voting Rights from Selma to Montgomery. And Ms. Boynton is the one who helped convince Dr. King and other civil rights leaders to make their stand in Selma. She was one person who had a great idea and figured out how to make it run, or in her case, march. I thanked Amelia Boynton when I got off that plane for training a whole generation of organizers who fought to redeem the promise of America. And I thanked her for inspiring me to do this work that is grounded in the fundamental issues of equality, freedom, and justice. And she smiled, she looked at me for a moment, and she finally replied to me, "Honey, I'm not done yet." Miss Amelia Boynton is over 100 years old, and she's not done yet. And the truth is that we're not done either, particularly when it comes to realizing the promise of health equity. As your Surgeon General, I pledge to you that health equity is not going to be just some section on our website that we will tweet about when convenient. In fact, during my tenure as Surgeon General, creating a culture of prevention and health equity will be the cornerstones of all the work that we do across all issue areas. We invest the majority of our health resources as a country in treating illness and only a small fraction in preventing it. I want us to be a nation that is as good at preventing disease as we are at curing it. I also believe that one's health shouldn't be determined by what zip code you were born in, what zip code you live in, your gender, your race, or your ethnicity. In a country as great as ours, every man, woman, and child should have a fair shot at good health. And this is not just a health issue, it's also a moral issue of great urgency. With these two guiding themes of prevention and health equity, my office is seeking to build initiatives in the following areas. First, on physical activity, where we will be releasing later this year a call to action on walking in walkable communities. Recognizing that building walking into one's day can improve physical health, mental health, and emotional well-being, we want to build a national practice around walking, but we also want to focus attention on the fact that not everyone lives in neighborhoods where they can walk. I remember caring for a patient once in the hospital who had been dealing with obesity and with diabetes for many years. And she had been told by many doctors, including me when I first met her, that one simple thing that she could do to help increase activity would be to take a walk after dinner. But what many of us didn't realize until later was that for her, taking a walk in her neighborhood after dinner meant taking the risk of being mugged or shot. And she simply wasn't going to do that. And this is a problem that too many people face in their neighborhoods, where safety issues and violence prevent them from going out and living the active lives that they can. The second issue that we plan to focus on is around prescription opiate abuse. Many of you know that the opiate epidemic has exploded all across America, in small towns and in big cities. In 2013, 11 million people reported the non-medical use of prescription opioids, and over 16,000 people died from prescription opiate-related overdoses. We have good reason to, in fact, suspect that that number is even higher. But the rapid rise in prescriptions that doctors and nurses and PAs and others are writing, have unfortunately been strongly associated with this sharp rise in morbidity and mortality over the last 10 to 15 years. And that's why we will be looking to build a movement in medicine, in dentistry, in nursing to reduce the prescription opiate problem by addressing prescription writing practices. We will also be seeking to do this by improving our training in how to treat pain, an area where many of us, as we went through training, did not receive a great amount of attention or focus in. Our third area of focus will be mental health and emotional well-being. And in this area, in the areas of mental health and emotional well-being, we will work with faith communities and health providers to change the negative attitudes that are still associated with mental illness, attitudes that prevent people still from coming forward and getting the help they need. Our fourth area is nutrition, where we are exploring ways to address the overconsumption of sugar in America, which is contributing to obesity and diabetes, conditions which disproportionately affect minority communities. Our fifth area is violence, where in particular we will be focusing on engaging men in ending this scourge of violence against women. And sixth, I would be remiss if I did not mention tobacco, where we will not only continue the strong legacy of our office and my predecessors, the former Surgeons General, but we will also focus on reducing traditional smoking, reducing smokeless tobacco use, and we'll also focus on increasingly addressing e-cigarettes, which are finding their way into the hands of children at an alarming rate. As Surgeon General, I want to modernize how we communicate about these issues, using traditional methods and new technology, recognizing that in 2015, many people don't watch the news and don't read the newspaper. They get their information from other sources. That means we have to deliver information using different messages, using different messengers, and using different platforms. But I also want us to go beyond disseminating information to working directly with communities to translate that information into action. That's why community partnerships with faith groups, with employers, with schools, and civic organizations are such an essential and important part of our work. Additionally, I want to say a quick word, but an important word, about the U.S. Public Health Service Commission Corps. It's a group that I am privileged to lead as Surgeon General. The Commission Corps is made up of 6,700 public health professionals who work each and every day to improve health in communities all across the nation, in some 800 locations. They also deploy during times of emergency to address public health crises, as they have done during earthquakes, hurricanes, 9/11 and other terrorist attacks, and disease outbreaks. These brave men and women, some of whom are here today, are our nation's soldiers for health. They are driven by a passion to serve the underserved, and they will be essential as we seek to address the great healthcare challenges that we are facing. Now, as healthcare providers, you and I are keenly aware that health is not just about diagnosis and treatment, but we know that it's also about meeting people where they are. It's about building relationships that are based on trust. We know that public health doesn't exist in a vacuum. It's intrinsically linked to education, to employment, to the environment, and to poverty. The health choices that people often make are influenced most by forces in their community, and sometimes least by what we do in our hospitals and in our clinics. And that's why we need to help build collaborations across sectors with faith groups and with schools, with employers, as well as with civic organizations, and with people who may think that they have no role to play in health, but who can in fact make some of the biggest differences. Health is and has always been a shared responsibility. The only question has been, do we choose to recognize that? And our actions as a community must reflect this shared responsibility. Now, I need your help, and I need your partnership to address these challenges and to build a culture of prevention and health equity in America. I need your help to bring health messages to communities and to build these local cross-sector collaborations to address the underlying determinants of health. Because together, I want us to also help build a workforce that represents the patients that it serves and that possesses the cultural competence to deliver truly good care. This means increasing the number of minorities who are delivering care and who are guiding public health. And this is a goal that I am firmly committed to. In the end, we are living in a moment of unprecedented challenge and urgency. But we are also living in a moment of unprecedented change and opportunity. The challenges that we face are about much more than just health. They're about equity, and they're fundamentally about the kind of nation that we want to be. They're about whether we can make good on the promise of America as a nation that values all lives equally. It can be easy to feel discouraged by the magnitude of what lies ahead. But when I find myself doubting or wondering if we can do what needs to be done, I remember the extraordinary people that I have met during my travels as Surgeon General. I remember the great need they speak of and how they are looking to us, their healthcare leaders, for help. I remember the innovation that is already happening in communities all across the country, which often just need a little bit of support. And I remember a conversation I had years ago with a friend of mine, Lisa, who's a primary care doctor in Washington State. When we were talking once, Lisa revealed to me that she had the great privilege and honor to be part of the March on Washington years ago with Dr. King. And she recounted to me the uncertainty and fear that she held as she went into that march, that sat side by side with the hope and the optimism that she held, thinking that perhaps this could be a turning point in history for us as a people and for us as a country. And I'm so glad that it was, because for Lisa and for millions of other people, that moment, that March on Washington, was a moment, an inflection point in history. And Lisa told me that she tells her grandkids often about what it was like to be there with Dr. King on that day, to be a part of history. and to know that her voice and the voice of millions of others could make a difference. And I've thought about that story many times since then. I've thought about the moment that we are in right now, this important moment in history. And I've thought that if my fiancée, Alice, and I are so lucky as to have children someday, what would we want to be able to tell our children and our grandchildren about what we did at this extraordinary moment in history? Well, I want us to be able to tell them that despite all of the obstacles that we faced, despite all the people who said that things couldn't get better, that we never stopped believing that it was worth fighting for a nation in which every person has a fair shot at a healthy life. I want us to be able to tell our kids that at a time of uncertainty and great need, that we joined with the people and the institutions around us and restored faith in what we could do when we came together for a common cause. And I want to tell them that ours was a generation not defined by age, but by spirit, but a generation nonetheless of whom much was demanded, and one that stepped up and delivered, building a foundation of health for a nation. The NMA has long stood up for health and equality, and I traveled here today to tell you that you do not stand alone. I stand with you, and together we will make the promise of America real for every man, woman, and child. Thank you very much.